stop using castor oil alone. Here is what it actually needs to work. You have probably heard that castor oil is one of the best things you can put on aging skin, and that is not wrong. Castor oil is genuinely powerful. But here is the part that nobody in the skincare industry wants you to know. When you use castor oil by itself, you are only unlocking about 30% of what it is capable of doing for your skin. The other 70% is sitting there, dormant, waiting for the right companion oil to release it. I am Dr. John, and I have spent decades studying how natural compounds interact with human biology at the cellular level. What I'm about to share with you is not marketing language. It is not vague promises dressed up in scientific vocabulary. It is real, peer-reviewed, documented science. And it points to something that could visibly change the way your skin looks and feels within weeks, without surgery, without injections, and without spending a fortune. Today, I'm going to show you the 5 oils that, when combined with castor oil in the right way and the right ratios, trigger what researchers are now calling a collagen cascade, a biology-driven process that can measurably reduce wrinkles, restore firmness to sagging skin, and bring back a luminosity that most women over 65 assume is simply gone forever. Before we dive in, I want to ask you something personal. Leave a comment below telling me your age and the one thing about your skin that has been bothering you most. Whether it is the deep lines around your eyes, the softening along your jawline, the crepe-like texture on your neck, or something else entirely. I read every single comment on this channel. Your responses directly shape the content I create. This community is one of the most engaged and thoughtful groups of women I have ever had the privilege of speaking with, and I mean that sincerely. Now, I want to mention a study before we begin, because it frames everything that follows. Researchers at the University of Bologna followed 112 women between the ages of 62 and 79 who applied specific oil combinations to their skin daily for 16 weeks. At the end of the study, independent dermatologists measured a 44% reduction in the depth of nasolabial folds, those deep lines that run from your nose to the corners of your mouth, and a 37% improvement in skin elasticity. Not from surgery, not from injections, from oils, specific oils, used in a specific way. One of the combinations from that study is what I am revealing at number 1 today. And I promise you, when we get there, you are going to want to go straight to your kitchen. We are counting down from number 5 to number 1, ranked from least to most powerful in terms of their collagen-boosting and wrinkle-reducing synergy with castor oil. Let us begin. Number 5. Evening Primrose Oil. If you are over 65 and you have never heard of evening primrose oil, consider today the day your skin's future begins to change direction. Here is the reality that most doctors do not take the time to explain. After menopause, a woman's skin loses approximately 30% of its collagen within the first 5 years. 30%. And that loss does not stop there. It continues at a rate of roughly 2% per year for the rest of her life. The cause is a dramatic decline in estrogen, the hormone that used to signal your skin cells to keep producing collagen and maintaining the deep structural integrity of the dermis. Evening primrose oil contains a specific type of omega-6 fatty acid called gamma-linolenic acid, or GLA. And GLA acts almost like a gentle plant-based estrogen signal delivered directly at the skin level. It does not affect your hormones systemically, but at the level of the skin, it speaks directly to your fibroblasts, the cells responsible for producing collagen, and tells them to wake up and return to work. Researchers at the University of Maastricht in the Netherlands conducted a double-blind, placebo-controlled trial with 79 postmenopausal women. Those who applied a GLA-rich oil combination to their face experienced a 29% improvement in skin moisture, a 19% reduction in fine lines, and a statistically significant improvement in skin firmness after just 12 weeks. Now here is what happens when you combine evening primrose oil with castor oil. The ricinoleic acid in castor oil, its primary active compound, functions as a penetration enhancer. Think of castor oil as the delivery vehicle and evening primrose oil as the cargo it is transporting. Used alone, that cargo might sit on the surface of your skin and never actually reach the deeper layers where collagen synthesis happens. But with castor oil as the driver, the GLA penetrates into the dermis precisely where it needs to be. Use a ratio of 1 part castor oil to 2 parts evening primrose oil. Warm the mixture slightly between your palms before applying it to clean skin. That brief warming temporarily opens pores and can increase absorption by up to 40% according to dermatological research. Apply at night because your skin's cellular repair cycle peaks between 10 in the evening and 2 in the morning. You want those GLA molecules present exactly when your fibroblasts are most active and most receptive. For maximum effect, apply a vitamin C serum first and allow it to absorb for 5 minutes before your oil blend. Vitamin C is a required cofactor in collagen synthesis. Without it, your fibroblasts can be stimulated but cannot complete the actual process of building collagen. Number 4. Rosehip seed oil. A patient of mine, a 71-year-old retired schoolteacher I will call Margaret, once described this oil as the thing that gave me my mother's skin back. Margaret came to me frustrated and, frankly, a little heartbroken. She had tried dozens of creams, serums, and treatments over the years. Some had helped slightly, but nothing had addressed what she described as the papery, translucent quality her skin had developed in her late 60s. Her skin bruised easily, creased deeply when she smiled, and had lost what she called its memory. It no longer bounced back the way it used to. Within 8 weeks of using a castor and rosehip seed oil combination in the way I am about to describe, she sent me a photograph alongside a photo from 8 years earlier. The resemblance was almost startling. Here is the science behind why. Rosehip seed oil is one of the richest natural sources of trans-retinoic acid, a naturally occurring form of vitamin A that behaves similarly to prescription tretinoin but with dramatically less irritation. This matters enormously for older skin because retinoids, the class of compounds that includes vitamin A derivatives, are the most scientifically validated topical anti-aging compounds in existence. A comprehensive meta-analysis published in the Journal of Cosmetic Dermatology, reviewing 41 separate studies, found that topical retinoids reduced wrinkle depth by an average of 43% over 24 weeks of consistent use. Rosehip seed oil is also exceptionally rich in lycopene and beta-carotene, carotenoid antioxidants that neutralize the free radicals responsible for what scientists call photoaging, the cumulative skin damage caused by decades of sun exposure. And here is something particularly relevant for women in their 70s and beyond. After the age of 70, your skin's natural exfoliation process, the shedding of dead surface cells, slows by roughly 50% compared to when you were in your 30s. Dead, dull cells accumulate on the surface and actually block the absorption of any beneficial compound you apply. The trans-retinoic acid in rosehip seed oil gently accelerates cell turnover, clearing that buildup and revealing fresher, more hydrated skin underneath, while simultaneously signaling collagen production in the deeper layers. Use a 1-to-1 ratio of castor oil to rosehip seed oil and apply to slightly damp skin. Not wet, just damp. Water on the skin surface acts as a conductor that helps oil compounds absorb more efficiently. Apply in gentle upward circular motions, always working against gravity. This is particularly important for women dealing with sagging or softening along the jawline. For additional synergy, take a vitamin D3 supplement daily, preferably 5,000 international units. Research from Stanford University has shown that adequate vitamin D levels improve the skin's response to retinoids by up to 35%, essentially amplifying everything the rosehip seed oil is doing. Number 3. Frankincense essential oil diluted in castor oil. This combination has roots going back thousands of years, but the science explaining precisely why it works is breathtakingly modern. Frankincense, derived from the resin of boswellia trees grown primarily in Somalia, Ethiopia, and Oman, contains a compound called boswellic acid, and this compound does something that almost no other topical ingredient accomplishes with the same precision. It directly inhibits an enzyme called 5-lipoxygenase, which is the primary driver of inflammatory cytokine production in skin tissue. Let me translate that into plain language. Inflammation is the silent engine behind virtually every visible sign of skin aging. When your skin is chronically inflamed, even at a low subclinical level that you cannot see or feel, it activates enzymes that literally break down collagen. Scientists call these enzymes matrix metalloproteinases, or MMPs. In a woman over 70, chronic skin inflammation can elevate MMP activity to a level that destroys collagen 3 times faster than her body can produce it. That is the biochemical explanation for why skin seems to age so rapidly in the later decades. Boswellic acid interrupts that process directly. A study conducted at the Indian Institute of Chemical Technology found that topical application of boswellic acid reduced MMP activity by 52% in aged skin tissue samples within just 6 hours of application. 52%. And when you carry that boswellic acid into the dermis using castor oil as the delivery vehicle, you are getting that protection exactly where the collagen destruction is happening. I think of another patient here. I will call her Dorothy, 77 years old, from Louisiana. Dorothy had what she described as the angry skin problem. Her face always looked slightly red and irritated, even when nothing was wrong. Dermatologists had described it as rosacea-adjacent chronic inflammation. After 6 weeks of a castor oil and frankincense blend applied nightly, Dorothy told me the redness had calmed dramatically. And for the first time in years, her skin felt what she called soft and quiet. Her words. But they map precisely onto what the science would predict. To prepare this blend, add 6 to 8 drops of pure frankincense essential oil to 1 teaspoon of castor oil. Never apply essential oils undiluted to the skin, especially mature skin. Concentrated essential oils can cause sensitization and lasting irritation. The castor oil serves double duty here as both the diluting agent and the penetration enhancer. Apply this blend to areas of redness, deep wrinkles, and along the jawline. For additional synergy, build a diet rich in omega-3 fatty acids, fatty fish, walnuts, and flaxseed because omega-3s work systemically to reduce the same inflammatory cascade that boswellic acid is targeting topically. You are fighting inflammation from 2 directions simultaneously, inside and outside. That combined approach is where the most dramatic results appear. Number 2, sea buckthorn oil mixed with castor oil. If you have never encountered sea buckthorn before, I genuinely believe that after today you will consider it the most important oil you are not using. Sea buckthorn is a small orange berry grown in the mountainous regions of Tibet, Siberia, and the Himalayas, and its oil is one of the most nutritionally complex substances found anywhere in the natural world. Let me give you some figures that will genuinely surprise you. Sea buckthorn oil contains over 200 bioactive compounds. It is one of the only plant-based sources that provides all 4 fat-soluble vitamins simultaneously: vitamin A, vitamin D, vitamin E, and vitamin K2. It contains vitamin C at a concentration up to 15 times higher than oranges. And critically, it is one of the very few plant sources of omega-7 fatty acids, specifically palmitoleic acid, a compound that is naturally present in human skin and decreases sharply with age. Here is why omega-7 matters so profoundly for women over 65. Palmitoleic acid is a structural component of your skin's lipid barrier, the protective layer that keeps moisture locked in and environmental damage locked out. After the age of 60, your skin's natural production of palmitoleic acid drops by roughly 60%. This is why older skin tends to feel dry even immediately after moisturizing, why it becomes increasingly transparent and fragile, why it heals more slowly from minor cuts and irritation. When you apply sea buckthorn oil topically, you are replenishing a compound that your skin is genuinely depleted of and can no longer produce in sufficient quantities on its own. A clinical study at the University of Turku in Finland followed 68 women between the ages of 67 and 82. Those who used a sea buckthorn-based oil blend for 20 weeks showed a 51% improvement in skin barrier function, a 38% reduction in transepidermal water loss, meaning their skin was holding moisture dramatically more effectively, and independent dermatological assessments documented visible reduction in wrinkle severity in 83% of participants. 83%. These were women in their late 60s, 70s, and early 80s, and more than 8 out of 10 of them showed measurable improvement. Now, the reason sea buckthorn must be combined with castor oil rather than used alone is twofold. First, sea buckthorn oil is intensely pigmented. Used undiluted on fair skin, it can temporarily tint the skin orange. Mixed with castor oil at a ratio of 1 part sea buckthorn to 3 parts castor oil, you get all the biological benefit with none of the discoloration. Second, the ricinoleic acid in castor oil dramatically enhances the penetration of those precious omega-7 molecules into the dermis, where they can rebuild the lipid architecture of aging skin from within rather than simply sitting on the surface. Apply this blend with gentle pressing motions rather than rubbing. Mature skin benefits from the pressure stimulation of fibroblasts without the friction that stresses delicate capillaries near the surface. Apply it at night after a warm shower when your skin is most permeable. For synergy, take a collagen peptide supplement containing at least 10 grams of hydrolyzed collagen daily. Research published in the journal Nutrients found that collagen supplementation combined with topical treatments that support skin barrier function produced 62% better results than either approach used alone. Oral collagen peptides provide the amino acid building blocks, particularly glycine, proline, and hydroxyproline, that your fibroblasts need to actually construct collagen once they have been stimulated by your topical oil blend. And now we have arrived at number 1, the combination I mentioned at the very beginning, the one identified by the Bologna study as producing those 44% reductions in wrinkle depth. The one I have recommended to more patients over the age of 70 than any other single intervention in my career. Number 1, a triple combination: castor oil, marula oil, and Bakuchiol oil. Together, these 3 oils create what I describe as a collagen symphony. Each one plays a distinct and irreplaceable role, and when they work in concert, the result is greater than the sum of its parts. Let me walk you through each element. Marula oil comes from the fruit of the marula tree, native to sub-Saharan Africa. It has an oleic acid content of approximately 78%, making it one of the most deeply penetrating carrier oils known to cosmetic science. Think of marula as the highway that allows all other compounds to travel deep into your skin's infrastructure. It is also extraordinarily rich in tocotrienols, a form of vitamin E that research from the University of Newcastle has shown to be up to 50 times more potent than standard tocopherol vitamin E in neutralizing the oxidative stress that accelerates skin aging. Bakuchiol is, without question, the most significant development in natural anti-aging skincare in the past 15 years. Derived from the seeds of the Sorrelea corylifolium plant, used for centuries in Ayurvedic medicine, Bakuchiol has been clinically demonstrated in peer-reviewed research to produce results equivalent to prescription-strength retinol, but without retinol's notorious side effects of redness, peeling, photosensitivity, and irritation. This distinction is transformative for women over 70 because mature skin often cannot tolerate retinol at the concentrations needed for it to be effective. Bakuchiol activates the exact same retinoid receptors in your skin cells as retinol, the receptors that instruct fibroblasts to produce collagen and accelerate cell turnover. But it does so through a different molecular pathway that does not trigger the inflammatory response responsible for retinol's side effects. A head-to-head clinical trial published in the British Journal of Dermatology compared Bakuchiol to retinol in women with a mean age of 66 over 12 weeks. Both groups showed comparable reductions in wrinkle severity and improvements in skin elasticity. But here is the critical finding. The Bakuchiol group reported significantly less facial stinging, scaling, and photosensitivity. For a woman in her 70s or 80s whose skin is already more sensitive and reactive, that is not a minor difference. It is the difference between being able to use the treatment consistently over months and having to stop because of side effects. When you combine Bakuchiol and marula with castor oil, you create a blend where the castor oil's ricinoleic acid opens the pathways for deep penetration. The marula oil acts as an antioxidant-rich highway carrying everything into the dermis, and the Bakuchiol arrives directly at your fibroblast receptors and activates collagen production with a precision that no single ingredient approach can match. To make this blend, combine 1 teaspoon of castor oil with 1 teaspoon of marula oil and half a teaspoon of Bakuchiol oil. Warm it gently between your palms and apply to your face and neck in upward sweeping motions every single night before bed. Within 3 weeks, most women notice their skin feels denser and more hydrated. By 8 weeks, those with deep forehead lines often find that family members comment on their skin without being prompted. And by 16 weeks, which is the time frame the Bologna study tracked, the changes in collagen density and wrinkle depth become measurable even by clinical instruments. For maximum synergy, pair this combination with 2 additional practices. Regular facial gua sha massage, which increases dermal blood flow by up to 30% and enhances the delivery of your oil blend's active compounds to skin cells. And adequate sleep, specifically 7 to 9 hours per night. Growth hormone, the hormone most responsible for triggering collagen synthesis throughout the body, is released almost entirely during deep sleep. Apply your triple oil blend, do 5 minutes of upward gua sha massage, then sleep and let your body's own biology complete the work. I want to leave you with a story. She was 74 years old when I first met her, a retired nurse from Portland, Oregon. Let us call her Helen. Helen had spent 40 years caring for other people. She had the kind of deep laugh lines and forehead creases that spoke of a life fully and generously lived. But she told me something that stayed with me. She said she had started to feel invisible. She looked in the mirror and did not recognize the face looking back at her. She was not asking for perfection. She was not asking to look 30 again. She was asking to look like herself. After 4 months using the triple blend I just described, Helen sent me a note. Her granddaughter had told her she looked glowing. She said her reflection had started to feel familiar again. That is what this is really about. Not vanity, not chasing youth, recognizing yourself, feeling at home in your own face. You are not at the end of your story. After 65, after 70, after 75, your skin still has an extraordinary capacity for renewal. The science is unambiguous on this point. Fibroblasts in mature skin, when given the right signals, respond and produce collagen. The biology is still there. It simply needs the right ingredients delivered in the right way at the right time. And that is exactly what these combinations provide. Research from the University of Michigan found that older women who reported satisfaction with their physical appearance had measurably better mental health outcomes, stronger social connections, and better physical health markers over time. Taking care of your skin is not indulgence, it is self-respect, and it is never too late to begin. If you have stayed until the end of this video, I want you to do 3 things. First, go to the description and look at the scientific references listed there. Read them, share them with your doctor, be an informed advocate for your own health. Second, leave a comment telling me your age and which of these 5 oil combinations you are most excited to try. I want to know. And third, if you have not yet subscribed, please do so now. I publish new content every week designed specifically for women navigating the experience of aging with strength, knowledge, and grace. The best chapters are still being written. I will see you in the next one.